بسم الله الرحمن الرحيم. نكمل محاضرات deep structure of the neck. وصلنا إلى blood supply of the neck ونكمل supply قلنا هو يبدي carotid artery, the main vessel in the neck, and the other vessel هو subclavian artery. The main artery to upper limb is called various names: subclavian artery, axillary artery, brachial artery. During its course إذا يبدي subclavian artery وبعدين يروح axillary artery and تيجي brachial artery. هاي كلها اللي artery of the second branch of the aortic arch. The territory supplied by subclavian artery extends as far as the forebrain, abdominal wall, and fingers. The left subclavian artery arises directly from the arch of aorta, where the right subclavian artery is from the brachiocephalic trunk. The course of each subclavian artery may be considered in three parts: from the origin of the vessel to the middle border of anterior scalenus muscle, behind the anterior scalenus muscle to the lateral border of the first rib, from the lateral border of the first rib where the subclavian changed name to axillary artery. Then three branch division of the subclavian artery. The first part arches superiorly and laterally from posterior to sternoclavicular joint, is deep placed and cover the sternomastoid, sternohyoid, and sternothyroid muscles. The second part of subclavian artery extends from a few centimeters superior to the clavicle. It lies anterior to the apex of the lung and scapula of the parietal pleura. The third part of subclavian artery is the most superficial, and its pulsation can be felt on deep pressure. It lies mainly in the supraclavicular triangle on the first rib, the anterior to lower trunk of the brachial plexus. Now, the branching of subclavian artery. Most of branch arise from the first part of subclavian artery. إذن نقسمها إلى first, second, and third part. The most part is from the first part. The first artery is the vertebral artery, supply chiefly the posterior part of the brain. Arising medial to the anterior scalenus, it ascends through the foramen transversa of C6 to C1 vertebrae, past posterior the lateral mass of the atlas and along the posterior arch of the atlas. It enters the posterior atlanto-occipital membrane and enters the cranial cavity by passing superiorly through foramen magnum. At the lower border of the ponus, it unites with the vessel of the opposite side to form the basilar artery, which ends by dividing into the two posterior cerebral arteries. That it is the first arteriovertebral artery. The course of vertebral artery may be considered in four parts: cervical part, vertebral part, suboccipital part, and intercranial part. The cervical part ascends posterior to the common carotid artery in the pyramidal space between the longus colli and anterior scalenus muscle. The vertebral part, accompanied by venous plexus and a sympathetic nerve fiber, give branch to the spinal cord and vertebrae. Now, the second artery from first part of the subclavian artery is the internal thoracic artery. The third artery is the thyrocervical trunk, divided almost into 2 to 3 branches: the inferior thyroid, suprascapular, and transverse cervical arteries. This is the third branch of the subclavian artery, is thyrocervical trunk. Now, the branching of thyrocervical trunk. The first branch is the inferior thyroid artery, ascend anterior to the anterior scalenus and arch medially anterior to the vertebral vessel and posterior to the carotid sheath. It is closely related to the middle cervical ganglion and the recurrent laryngeal nerve. It enters the posterior surface of thyroid gland. The inferior thyroid artery gives branch to the vertebrae, ascending cervical artery, and thoracic inferior laryngeal artery, and trachea, pharynx, esophagus, and thyroid gland, all branching from the inferior thyroid artery. The second branch from cervical from the suprascapular artery passes lateral across the anterior scalenus and the phrenic nerve, and then across the subclavian artery and cord of brachial plexus. Finally, contributes to the anastomosis around the scapula. It gives of suprasternal, acromial, and articular branches from this artery. The third branch, the transverse cervical artery, passes laterally more superior and then suprascapular artery across the anterior scalenus and the phrenic nerve, and then across the trunk of brachial plexus in the posterior triangle. This is the transverse cervical artery. It supplies the trapezius muscle as superficial cervical artery. The fourth branch of subclavian artery, the costo-cervical trunk, arches over the capilla of the parietal pleural to reach the neck of the first rib, were divided into two branches. The deep cervical artery, which ascends to anastomosis with the eccentric branch of occipital artery, and the highest intercostal artery, which ascends posterior to pleura and usually give of the first two posterior intercostal artery. The fifth branch, the dorsal scapular artery, generally passes between the trunk of the brachial plexus and accompanies the dorsal scapular nerve to the rhomboid muscles. It may, however, be replaced by a deep branch of the transverse cervical artery. Now, the venous drainage of the neck. We start the subclavian vein. The subclavian vein, which is the contribute of axillary vein, passing anterior to the anterior scalenus and unite with the internal jugular vein to form the brachiocephalic vein. The other vein, internal jugular vein. The internal jugular vein drains the brain, neck, and face. It commons in the jugular foramen as the continuation of the sigmoid sinus. At the base of the skull, the internal carotid artery and the carotid canal lie anterior to the internal jugular vein and jugular foramen, and the two vessels are thus separated by cranial nerve 11 and 12. The internal jugular vein descends in the carotid sheath and is hidden by the sternomastoid muscle. The internal and common carotid artery accompany the vein medially, and vagus lie posterior to between the veins and the arteries. The deep cervical lymph node lie along the course of internal jugular vein. The vein passes deep to the interval between the two heads of sternocleidomastoid muscles, the end posterior to the medial and end of the clavicle by uniting with the subclavian vein to form brachiocephalic vein. The dilatations are found in the beginning and near its end, superior and inferior bulbous. The tributaries, which are variable, include the inferior petrosal sinuses and the pharyngeal, lingual, superior, and middle thyroid veins. The right lymphatic duct on the left, the thoracic duct, open usually into internal jugular vein at or near its junction with the subclavian vein. Now, the main vessels, thoracic vessels, is thoracic duct. The thoracic duct receives the lymph from most of the body, including left side of the head and neck. The duct, on leaving the thorax, arch laterally over the apex of the left pleura, anterior to the sympathetic trunk and left vertebral artery, the subclavian artery, phrenic nerve, and the anterior scalenus and posterior to the carotid sheath. Ascending through the posterior mediastinum between the aorta and zygous vein, it receives the left jugular trunk and the end variable anterior to the left first part of left subclavian artery in or near the angle between the left internal jugular and subclavian vein. and usually empty into left brachiocephalic vein at the junction of the left internal jugular and subclavian vein. Other duct, the right lymphatic duct. The right lymphatic duct receives the lymph from the right side of the head and neck, right upper limb, and right side of thorax. This duct, which is seldom present as single, the structure has a component the right jugular, subclavian, and brachiomediastinal trunk that drains separately into the right internal jugular vein, the subclavian vein, or both. The lymphatic drainage of head and neck. All lymphatic vessels from the head and neck drain into deep cervical node, either directly from the tissue or indirectly after traversing a more superficial group of nodes. Several of this group of lymph nodes form a pre-cervical collar at the junction of head and neck. These are the occipital, retroauricular, mastoid, carotid, submandibular, buccal or facial, and submental node. The superficial tissue drain into this group and also into the superficial cervical node. The superficial cervical node are first the posterior triangle along the sternal jugular vein and second the anterior triangle along the anterior jugular vein. The deep cervical nodes include several groups, the most important of which form a chain along the internal jugular vein, mostly under cover of the sternomastoid muscle. The jugulo-digastric nodes lie on internal jugular vein immediately inferior to the posterior belly of the gastric muscle. It receives important efferent from the posterior triangle and from the tonsil. The second group, jugulo-omohyoid node, lie in the vein immediately superior to middle tendon of omohyoid muscle. It receives efferent from the tongue. The one group of deep node is found in the posterior triangle as related to axillary nerve. Other groups are laryngeal, peritracheal, pretracheal, paratracheal, and retropharyngeal. These take part in the drainage of deeper structure, middle ear, and nasal cavity. The efferent vessel from the deep cervical node from jugular trunk, which usually join the thoracic duct on left and enter the internal jugular subclavian junction on the right. Thank you for your listening to this lecture.